founder of Nigerian Mental Health, and I want to tell you a little bit about what our organization does. Nigerian Mental Health is a global community of mental practitioners with over 30 mental health organizations as members. It's increasing awareness and knowledge of resources focused on Nigeria, Pan-Africa, and diaspora mental health. And finally, and fourth, it's conducting programming focused on transformational and sustainable change in Nigeria's mental health landscape. When you bring some of the best actors that are working every day to improve individuals' psychological well-being, we need to do big things. And so this is a product of our collaborative efforts. We also have 3 areas of programming focused on policy advocacy, data information, and wellness program. You can learn more about Nigerian mental health on our website, www.nigerianmentalhealth.org, to get resources to things like crisis hotlines in Nigeria, information on our programs, information on our members, etc. This mental health conference, press conference, is focused on 3 core areas. The objectives are 1, awareness. It's very important with the new Mental Health Act being passed and the gazetted copy now being available that we discuss its critical implications for Nigerian citizens. Secondly, it's to identify some of the stakeholders' actions. There's a lot of people that are involved in the mental health field, and we want to highlight the role that diverse actors play during passing of the Nigerian Mental Health Bill and also play in implementing the law going forward. Third is to identify next steps. We want to detail critical actions and measures necessary to make mental health a national priority for the upcoming administration, such as decriminalizing attempted suicide and ensuring successful legislative enforcement. With that said, we need to understand and be aware of the day that this mental health conference is being put on in honor of, which is World Health Day. World Health Day's theme this year is Health for All. Again, World Health Day theme for this year is Health for All. And this is an opportunity for us to motivate action to tackle the health challenges of not only today, but tomorrow. One of which is mental health, which is often neglected when we talk about conversations concerning about general right to health and well-being. With that said, I want to make some special acknowledgments of individuals within the Nigerian Mental Health network that this wouldn't be possible for, that help contributed not only their time, but also their fiscal resources to bring this event to bear. The first is MANI, which is Mentally Aware Nigerian Initiative. The second is PAC Consulting and Serenity. The third is Education Plus and ILERA Community Health Initiative. The fifth is JAILA's Development Initiatives. The sixth is Mental Health with Diddy Foundation. The seventh is NEEM Foundation. The eighth is the National Association of Social Workers in Nigeria. The ninth is the Nigeria American Institute for Mental Health. And the final one is the Institute for Counseling and Psychology. Without these specific Nigerian mental health members, we wouldn't have the ability to really make sure that this event went on and was live streamed to an audience, and we make sure that we get the proper awareness out. So over weeks of conversation, we have come together, professional associations, organizations, to come up with a press statement for this Mental Health Act. And I wanted to read the press statement that over 40 organizations, professional associations, including the leading professional associations, have signed concerning this event in its honor. In honor of World Health Day, civil society organizations outline a 10-point agenda for effective implementation of the Mental Health Act and launch Suicide Not Crime Nigeria, a campaign to decriminalize attempted suicide in Nigeria. Nigerian Mental Health and its network partners have been leading coordination and advocacy for the passage of the National Mental Health Act 2021. On January 5th, 2023, President Muhammadu Buhari made history by signing the Mental Health Act into law, marking a major milestone in Nigeria's efforts to improve support for psychosocial well-being. The new Mental Health Act is the first legislative reform adopted in the field since the country's independence. The regulation establishes human rights protections for those with mental health conditions, such as banning discrimination in housing, employment, medical, and other social services. It guarantees that those receiving treatments have the right to participate in the formulation of their medical plans and cannot have forced treatment, seclusion, or other methods of restraint without appropriate safeguards. It also improves care, enhances management of medical services, enshrines dignity and access to information, and ensures quality mental health services comparable to those with physical illnesses. Previous legislation was outdated and inhumane based on a regulatory regime that had colonial origins. To consolidate gains made by the Mental Health Act and in advancing human rights, other critical efforts must be initiated as we embark on a new political dispensation post Nigeria's 2023 recent presidential, national, and state assembly and gubernatorial elections. Our next steps, we now outline 10 next steps to advance the Mental Health Act and ensure psychological well-being is a national priority post-elections. The first is having a gazetted National Mental Health Act. The National Assembly and the Federal Ministry of Health should ensure published copies of the National Mental Health Act 2021 are available to citizens. Currently, the official copy of the legislation is not easily accessible on any government website for public engagement and review. This legislation ushers in new legal protections for those with mental health conditions and should be readily available on trusted government portals to inform citizens of their new rights. In the interim, a gazetted copy of the legislation will be available on Nigerian Mental Health's website, along with the legislative history of the regulation and memorandum submitted during the public hearing to help guide implementation of the act in the future. Secondly is Suicide Not Crime Nigeria, which will be further elaborated after this statement. Other critical regulatory reforms for those with mental health conditions should be enacted, such as decriminalizing attempted suicide, which is illegal according to Nigeria's criminal and penal codes and penalizes citizens with a 1-year jail term. The World Health Organization notes that criminalizing suicide discourages people from seeking help for their mental health and would be counterproductive for effective dispensation of the Mental Health Act. Individuals who try to take their lives are psychologically vulnerable and need support, not detention or jail. The public is encouraged to join thousands of others in adding their voices to repeal these laws by signing our petition available on our website. The third is the new administration should prioritize mental health. Nigeria's 2023 general election cycle has ushered in a new crop of political officials to legislate and govern for Nigerian citizens. While many candidates discuss critical social development goals in manifestos and campaigns, their policy priorities often excluded specific attention to mental health. To deliver on Nigeria's well-being holistically, newly elected and appointed officials should elevate mental health in their policies and programs. Fourth is increased mental health budgeting. As a percentage of Nigeria's signed 2023 budget, spending for health has increased from last year's budget of 4.7% to 4.9%, but the country's healthcare sector remains underfunded. Although progress is being made to improve funding, Nigeria has failed to meet the African Union's declaration to give 15% of the national budget to the sector. Additionally, budgetary allocation to mental health in Nigeria is limited, fluctuating between 3 and 4% of the entire mental health budget. The Mental Health Act establishes a mental health fund to provide financial resources for funding the legislation's provisions, but the Act does not specify the amounts the fund will contain or how it will be financed. There should be increased mental health parity as a percentage of the health budget and proper arrangements made to ensure the mental health fund has adequate fiscal resources. Fifth, nothing about us without us. Implementing and enforcing the National Mental Health Act should involve an implementation committee, including meaningful participation with the disability community and civil society. Mental health conditions are a leading cause of disability, according to the World Health Organization. Persons with psychosocial disabilities and their representative organization now know what is best for us in our community. We should be valued as integral and essential contributors to the Mental Health Act and other policies that concern us. The legislation encourages this, mandating engagement in various ways of persons with lived experiences of mental health conditions. There should also be a consolidated focal point and information exchange between key government agencies like the Federal Ministry of Health, National Commission for Persons with Disabilities, and other associated parastatals to help coordinate advocacy and mainstream issues pertaining to those with psychosocial conditions. Sixth, inclusion of diverse actors. Many stakeholders are involved in the mental health field and are championing improved psychosocial well-being for Nigerians. These include psychiatrists, psychologists, social workers, nurses, pharmacists, occupational therapists, advocates, disability specialists, and policy practitioners. This diversity of voices ranges from medical officials to activists, non-governmental organizations to professional associations, and others involved in the field. All of these stakeholders should continue to be acknowledged and carried along concerning implementation of the Mental Health Act and provisions of psychosocial well-being in Nigeria. Seventh is mainstreaming psychosocial support. Nearly 100% of funding for mental health in Nigeria goes towards psychiatric hospitals and drugs. We must expand our vision for how mental health is cared for, not just to include biomedical approaches that emphasize mental health conditions as brain diseases to be treated. Instead, we should expand mental health provisions to include increased funding and initiatives in psychosocial mental health practices that refer to a range of interventions that focus on psychological, social, and emotional well-being of individuals. These practices are often located in local and community levels and range from support groups, yoga, meditation, art and music therapy, recreational sports, or other wellness approaches. We need to ensure that we define clear metrics for Mental Health Act's success. Nigeria has many policies, but 1 in 8 Nigerians experience a mental health condition during the course of their lifetime, according to the World Health Organization, and only 10% get access to care. This is legislation that cannot afford to fail. To ensure its success, clear criteria should be established at the onset to measure the impact of the legislation. This should include defined roles, timelines, and success metrics for effective monitoring and evaluation. Ninth is inclusion of mental health in primary healthcare centers. The Mental Health Act prescribes the adoption of community-based approaches to the provision of mental health care services in Nigeria. This should involve inclusion of mental health support services delivered at primary health care centers across the country. Resources such as mental health first aid and other basic assistance and support at the primary level will also serve as preventative healthcare functions for the grassroots. And finally, the final point of our 10-point agenda is this: domestication of the Mental Health Act. The legislation should be adopted at subnational levels as the state governments are critical actors in dispensation of healthcare for citizens. Currently, only 2 states in Nigeria, Ekiti and Lagos, have mental health legislation in the entire nation. And this 10-point agenda has been signed by over 40 civil society organizations, including the leading professional associations that are related to mental health in the field. With that said, I want to pass the agenda. With that said, I want to pass the agenda to my colleague from Nigerian Mental Health, Aisha Buba, to discuss more on the campaign that Nigerian Mental Health has launched, Suicide Not Crime Nigeria. Aisha?
To be able to ensure that this happens, criminal sanctions for those who attempt suicide goes completely against this summary of what the Mental Health Act stands for. The World Health Organization finds that this will only discourage people from seeking help, will discourage people from speaking up, because basically what the criminal code is saying is if you attempt suicide, you might as well succeed, because if you don't, then you're going to jail. So this limits the openness and willingness to seek help. Secondly, this law came from colonial times during imperialist rule, which was imposed on Nigeria along with many other countries. The UK, however, abolished this law under their Suicide Act of 1961, but Nigeria, since independence, has continued to use this British-era criminalization of suicide. Thirdly, it increases suicide, particularly in women. So in a study that was done in 2022, which explored on a global scale the criminalization of suicide, showed that countries that criminalize suicide have higher rates of suicide as opposed to ones that have decriminalized it and have put in place better structures to support people with suicide ideations. Fourthly, it's against global best practices. According to World Health Organization, at the beginning of the 19th century, most countries had laws that punished people who attempted suicide. However, in the past 50 years, many countries have decriminalized suicide. Recently, Ghana has also followed suit and decriminalized suicide. And lastly, stigmatization. The criminalization of suicide and the disapproval that comes with being convicted has a lasting impact on an individual, especially being termed an ex-convict. It can also go completely against the human rights advocacy of the Mental Health Act because it reduces their chances of getting jobs, reduces their educational opportunities, limiting their voting rights, limiting their access to healthcare and other basic needs that they should be entitled to. And for these reasons, we call on everyone who is here and those who are watching us live to please sign our petition that is on change.org to decriminalize suicide in Nigeria. Currently, we are at 3,000 signatures, and we need more signatures to draw the attention of relevant stakeholders to decriminalize suicide. Thank you.
To make it and ensure that each state have a primary health care agency or board, so that making the primary health care practice to operate under one roof, what we call PAC under one roof, making sure that every state has its own area of jurisdiction to make sure that primary health care gets to the grassroots. We know the importance of this signing of this act into law. And I want to also inform that the National Primary Health Care Development Agency, before now, has also a unit that takes care of the mental health issues. And I'm happy that you clearly stated it here. This is, your submission, the 10-point submission is reminding us to prioritize it, and we will do that. And I know that my chief executive will do that. And we have experts, neuropsychologists, neuropsychiatrists, and all the rest of them that also handle this aspect. And equally, I want to inform that even in the primary health care centers, you can get basic services like counseling, social supports like counseling and all the rest of them. We also have what we call health promotion. The health promotion aspect of it, make sure that our adolescents, our youths, the mothers, do you know that even when you're giving birth, you understand, or pregnancy can make people to be mentally deranged, because of the pains and all the rest of them. So all these things are provided in the primary health care level. You understand, and the primary health care center. So, and it's valuable and affordable in your domain, in your communities. And we have structures that make sure that this primary health care is monitored, is overseen by even the community members, making them major stakeholders, using the World Development Committees and the community structures. So, by and large, you have reminded us to ensure that primary health care is prioritized. Mental health is prioritized, and of course, we will not leave any stone unturned to continue to serve humanity in this regard. In making sure that we do the needful in the area of mental health, using the platforms, using our unit in the community health service department. On that note, I want to say thank you very much, and God bless.
Some persons with disability die up to 20 years earlier than those without disability. Persons with disabilities have twice the risk of developing conditions such as depression, asthma, diabetes, stroke, obesity, and poor oral health. Persons with disability face many health inequalities. Persons with disability find inaccessible and unaffordable transportation 15 times more difficult than for those without disability. Health inequalities arise from unfair conditions faced by persons with disability, including stigma, discrimination, poverty, exclusion from education and employment, and barriers faced in the health system itself. It is also a fact that 1 in 4 Nigerians, about 50 million Nigerians, suffer from mental health condition which needed an urgent attention. However, the signing of the Mental Health Act into law in January 2023 to address not only to ensure a better quality of mental health care services and promote recovery in Nigeria, but to protect the rights of persons who have mental health conditions, including persons with disability. It's a great joy to every one of us. The Act defines and protects the rights of Nigerians, including Nigerians with disability, with mental health conditions, with the Section 12 of the Act states that any person needing mental health services should not be subjected to any form of discrimination based on their condition. This means that women and girls with disability have the right to access all healthcare services, the right to protection from physical and mental abuse and exploitation, the right to human and dignified treatment, the right to expression, carers, and the government. It also provides for the right to equality standard of treatment, the right to appoint legal representation, the right to participate in treatment planning, the right to privacy and dignity, the right to information, and the right to confidentiality. Mental health illness is real, and special attention is needed because some communities are actually vulnerable, more vulnerable, like persons with disability.
And in the context of mental health now, this particular legislation, the National Mental Health Act, which the legislature has passed into law, and the President of the Federal Republic of Nigeria has assented to. This clearly, therefore, gives rights to health, specifically mental health, the legislative effect. It gives mental health legal backing. It gives mental health teeth to bite, teeth for enforcement. The other objective is to promote and protect the human rights and freedoms of all persons with mental health conditions and ensure that their rights are guaranteed. This is most very critical. The National Human Rights Commission hopes the Act will activate mental health programs and services that is free from violence, seclusion, restraint, ill treatment and abuse, as well as alternative practices where people's dignity is at the center of treatment and care. The Commission will advance public conversation regarding mental health and mental illness in order to dispel myths, ignorance, misconceptions, so as to create a climate of understanding and acceptance so people living with mental illness and substance abuse problems are meaningfully integrated into society and given equal opportunities to participate, protected from stigma and discrimination. The National Human Rights Commission looks forward to exploring partnerships, consolidating partnerships for promotion of mental health in Nigeria and protection of human rights of persons with various mental health conditions, as well as raise consciousness to the effect that mental health is considered at par with physical health. The Commission looks forward to enhanced access to mental health care and services in Nigeria, where the mental health system is adequately funded, and this is very important, that provides culturally safe, equitable, needs-based mental health services, and scaled up attention on social determinants of mental health. The Commission is keen about improved coordination to deliver integrated mental health services in the country and access to the prerequisites of good mental health. This reinforces the importance of multi-sectoral interventions to address social determinants. The issue of social determinants keeps reoccurring to address social determinants of mental health. The establishment of Department of Mental Health Care Services in the Federal Ministry of Health, pursuant to Section 2 of the Act, is of great significance, as the department is vested with the powers to administer the provisions of the Mental Health Act. In this connection, the National Human Rights Commission welcomes partnerships with the department and the entire mental health community to operationalize the Mental Health Act and give it life. National human rights institutions have a core responsibility to give content and meaning to various human rights provisions, which on their own seem to be mere principles and concepts. By operationalizing the Act, the mental health community would mobilize consciousness of government and society in the area of mental health as a critical component of right to health for improved care of persons with persons and families with various degrees of mental health conditions. This is, in summary, the perspective of the National Human Rights Commission in giving effect to the National Mental Health Act. The Commission looks forward to consolidated partnerships with the mental health community to operationalize the Act. Enacting the Act and assent by the President are not enough. It is important to take concrete steps to give effect to the Act in order to realize the intendment. Thank you.
There are some things that we can give contribution to this flight. Yes. There is no way we can create awareness of mental health and improve on the implementation without taking into cognizance the roles played by the faith-based organizations. Looking at our cultures, looking at the difficulties that we have in this part of the world, faith-based organizations are usually the first pathway to care for mental health. And if you look at the number of persons with mental health conditions that are seeking help from the faith-based organizations of the various religions, you can see that the amount is massive. So we have to take them into cognizance. And lastly, the Association of Psychiatrists is responsible for services at all levels of care. The primary, that's preventing and promoting and preventing health care. And the secondary, that is providing treatment of opportunities. And then the tertiary, that's rehabilitative roles in healthcare delivery. So with this, I am happy that all stakeholders as represented here are ready to now help in the implementation and are ready now to help in giving service delivery to mental health care in